This is an ultrasound of 25 years old female. She is giving history of amenorrhea for the last 2 months. Her pregnancy test is positive, beta ECG is raised, and she has severe pain, presented with severe pelvic pain radiating to the epigastric region. Now you see, this is the uterus in longitudinal section. All of this is the uterus. This is the outer boundary of the uterus, and the uterus measures 9.0 into 5.5 centimeters, and this is the endometrial canal. This area, from here to here, and from here to here, that is visualized, and that measures 21.7 centimeters, 21.7 millimeter in anterior-posterior diameter, and 5.2 centimeter in anterior in length. So it is a dilated endometrial canal, and it is filled with different strength internal echoes. And what else is seen is, in this particular view of the longitudinal section of the uterus, is this is all fluid filled with echoes of different strength. Now this is a real-time study. This is the transfer section. This is the transfer section in which you are seeing the uterus. This is the uterus, and this is the endometrial canal. You can see internal different strength, internal echoes, and the endometrial canal in this view measures 18.8 is definitely dilated, and with dilation it shows different strength, internal echoes. No pathology is seen relating to the myometrium. This is all fluid posterior to the uterus, and not only that, we see septations within this fluid. These are all septas. Now with Doppler there is no significant vascularity of this dilated, different strength internal echo filled dilated endometrial canal, and thus now when I move the probe, this is fluid. This is fluid tracking down in pelvic. This is a pelvic cavity fluid which tracks down posterior to the uterus here in the pelvic cavity. This is all fluid. Then I maneuver the probe towards the right adnexa. You see a small cystic area which is surrounded by an echogenic ring, freely placed in the region of the right adnexa. I'm sorry for the disturbance by the cell. Here it is, and this is the ectopic, ruptured ectopic sac, gestational sac. It measures approximately 19 into 13.7 millimeters, and the internal cystic area measures approximately 7.9 millimeter. This is all fluid, and this is consistent. This area that is I have shown in the box is consistent with the disloid gestational sac. As and now I'm going to move the probe upward in the abdominal cavity. You can see fluid around the liver, in the Morrison spout, in the paracollic gutter, right paracollic gutter, and from here it can be traced into the splenorenal angle. This is the kidney, this is the spleen, this is all fluid, and this is the fluid in the left paracollic gutter. From here I am moving downwards into the pelvis again, and this is the story, a case of ruptured ectopic pregnancy. Thank you very much.